So during this session, we actually tackled this particular topic with an exemplification of our actually ongoing ProBio trial. So the ProBio trial stands for Prostate Biomarkers, and this is a liquid biopsy biomarker-driven platform trial in men with metastatic prostate cancer. So where we are both treating men with metastatic hormone sensitive, but also treating men with metastatic castration-resistant disease using actually the output from the liquid biopsy assay. So what we are doing in this trial is actually screening men with metastatic prostate cancer. We take the liquid biopsy, we profile the cell-free DNA, and we select then the men that have detectable ctDNA to then using the biomarker profiles or the biomarker subgroups that have been detected in the cfDNA to then randomize these men to either standard of care or one of our biomarker-driven treatment arms. Now, the first data that we have learned from this trial is that indeed this whole concept, using a liquid biopsy in to study treatment selection is feasible. So screening men with ctDNA, we were able to randomize these men to either an AR pathway inhibitor or a taxane-based chemotherapy, or a standard of care control arm where it was a physician's choice. And what we have learned from that trial is that the men that were actually flowing into the investigational AR pathway inhibitor arm were outperforming the standard of care and the taxane-based chemotherapy. Looking actually then deeper into, okay, what is now the underlying biology there, or what biomarkers were actually driving that signal, then we actually learned that indeed the men that were having a AR wild type and TP53 wild type within the liquid biopsy were deriving the largest benefit from a treatment with AR pathway inhibitors compared to a taxane-based chemotherapy, followed by the Tempus ERG positive population as such. Very interestingly, we actually learned also that one of our other predefined biomarker signatures, TP53 altered disease, so where the TP53 has been inactivated, that these patients actually, irrespective of the treatment, were having the poorest prognosis. So irrespectively whether you were treating this man with an AR pathway inhibitor or a taxane-based chemotherapy, their outcomes were actually exactly the same for progression-free survival. Looking a little bit deeper into this particular biomarker signature, we actually performed an interaction analysis as well to infer the predictive value of TP53 alterations as such. By then splitting up our population within the investigational arms, we actually now had a randomized comparison between AR pathway inhibitors and taxane-based chemotherapy for two groups of men. Men where the TP53 was wild type, nothing was going on there, and another group of men where the TP53 has been inactivated. What we actually saw there in that interaction analysis was indeed that the TP53 wild type group, there in that group, the AR pathway inhibitor was outperforming the taxane-based chemotherapy with a median PFS of 15.2 months. But if we then compare that to the PFS estimates that were achieved within the TP53 altered group, there, irrespectively whether the men were treated with a taxane-based chemotherapy or an AR pathway inhibitor, they on average had a median PFS of around 7 to 8 months. So it was clearly denoting there that there was indeed some predictive value in there, and that overall TP53 altered disease is a very poor prognosis entity that clearly requires more or different treatment strategies in the long run. So this was a bit in a nutshell what has been presented during the PROSCA conference when it comes to using ctDNA as a treatment selector.